Welcome to K6 Wellness Revolution, where we believe health is worth fighting for. This podcast focuses on all things related to natural health, wellness, and vibrant living. We know your time is valuable, and I'm honored that you're spending some of it here. So get ready, because the Wellness Revolution starts right now. Welcome to the K6 Wellness Revolution podcast. I'm Sharon, owner of K6 Wellness Center in Dallas, Texas, where we blend trusted expertise, compassionate care, and a passion for helping you achieve optimal health. Because wellness isn't just a goal, it's a revolution. Today, we're talking about one of the most exciting breakthroughs in regenerative medicine, exosome therapy. This emerging therapy is showing real promise for healing chronic conditions, supporting the immune system, and even helping with genetic detox challenges. Today, I'm joined by Caleb Granger, CEO of Apex Medical, who's been leading the way in exosome research and application. He's here to explain what exosomes are, how they work, and why they might be the future of personalized cellular healing. So if you're curious about natural ways to support your body's natural repair systems, or you just want to understand how this therapy compares to things like stem cells or PRP, well, you're in the right place. So we're going to jump right in. Thank you so much for joining me today, Caleb. I really appreciate you sharing your time with us. So tell me a little bit about yourself. We've gotten just lightly acquainted, but can you kind of tell me who you are, how you came into this world of regenerative medicine, specifically exosomes?
Sure. One, thanks for having me. I appreciate you having me on your platform, and I love what you're doing, the way you're helping people in your area and throughout Texas and throughout the South. So you're really a benefit to this community. So thank you for doing that.
Thank you.
My background is this is my 25th year in medicine. Historically, I've been involved in spine, neurosurgery, and orthopedic surgery. That's been my background. On the design side, marketing, development, and then sales and distribution. So that is a very invasive intervention where you're typically seeing a patient who is at the end point of a variety of degenerative conditions, often with multiple comorbidities. About 3 years ago, I was made aware of the latest in terms of stem cell technology. I think lots of us are familiar with the idea of stem cells and what they do, just very generally, that they're these regenerative kind of, power packs that can regrow things. And kind of the earlier you get the stem cells, and if you can take those stem cells from a healthy person and put them into you, an unhealthy person, that some good will happen.
Hopefully.
And so, yeah, that's the hope, right? And so what we saw that in neurosurgery and spine surgery, we saw a real push towards stem cells, using stem cells as a regenerative therapy for the last maybe 10 or 15 years. In the last 2 or 3 years, what we found was they really didn't work. So as much as we hoped they would work, they just didn't. And so there's some real challenges with trying to transplant stem cells. Some of those challenges are that they are inflammatory in nature. So when you take stem cells and try to take them from a donor and put them into you, it creates an inflammatory response. Your body says, no, I don't want this. It's called a graft host response, graft-host. And so your body says, I don't want this, and tries to kick it out.
So much like you would get from an organ transplant. So
Exactly like that. Yep. It sees it almost as this foreign substance that you're trying to put into your body. And so, so that's a great promise, but that just didn't work. Another potential problem is that there is some potential chance, if you take stem cells from somebody else and put them into your body, that those stem cells can carry the donor's genetic code. And so if someone, for instance, has a predisposition genetically towards cancer, and you take their stem cell in and it works, it takes hold in your body, now you could go from not having a genetic predisposition for cancer to now having a genetic predisposition for cancer. And so that's a very real and scary proposition.
Yeah.
So those were challenges associated with stem cell transplantation. What was discovered about 6 or 7 years ago was that when stem cells worked, when they regenerated and did all of their healing, the way they worked was through this tiny particle called exosomes. And so exosomes are about 1/1000th the size of a cell, tiny, tiny. And in those tiny particles, they carry all the proteins, growth factors, and regenerative signals that the cells spit out. So 6 or 7 years ago, we knew exosomes existed, but we thought they were a waste byproduct of stem cell derivation, of deriving stem cells. You'd get exosomes, almost like dirty bathwater when you're washing the baby. Well, the baby's important, bathwater's not. That's how we thought about exosomes. What was discovered 6 or 7 years ago was that, in fact, it wasn't that it was a waste byproduct. They were actually the thing that did the healing work. And so, with that new knowledge, science has now applied what we now know about stem cells and how they work. Scientists and academia and clinicians are applying that to all of their specialties. And so what you see in the peer-reviewed literature, which is how kind of the medical world moves forward, right? People do things, they do it in a clinical study setting, they publish that setting, peers look at it and say, yes, this is a good study, and then it gets published.
Mm-hmm.
So what you see from 1965 to 2019 is that there's 0 studies on exosomes because it was kind of a moot point. No one, we knew they were particles. They didn't really have any use as far as science knew.
Right.
From 2020 to today, there's close to 40,000 peer-reviewed published studies in 4.5 years. In 25 years, I've never seen anything even come close to that. A single therapy that has come close to having that much clinical, preclinical, peer-reviewed, academic, published interest as stem cell exosomes are.
I agree. And it was really quite remarkable when I first started hearing about exosomes. And first, when I was hearing it, it was more in the aesthetic realm, honestly. Went to Google Scholar and just started looking at it. And anything you go to Google Scholar, you're going to see some good, you're going to see some bad, you're going to see a little bit of everything. But when and I would challenge our listeners and our viewers, go to Google Scholar and then type in exosomes and then choose something. Choose orthopedics, choose spine injury, choose Alzheimer's, choose autoimmune. You are going to see so many positives as far as therapeutic value, diagnostic value, in even we're going to go there. So I don't want to jump too far ahead in the conversation, but yeah, it's really remarkable how much is out there. And I think, to your analogy about it's applicable because they were throwing the baby out with the bathwater, right? And it does make sense. Like, yeah, these stem cells that we have such hope for because they're undifferentiated, like the possibilities are endless. We've got these brand new baby cells. Let's do something brand new and fresh and regenerate. But there's that risk, and then the possibility that nothing happens, which is still what you hear so much of from people who travel extensively trying to get stem cell therapy. And some people do get good results, and I don't want to diminish that, but by and large, I think that the results have been a little underwhelming for health outcomes, and the exosomes are really exciting, I think, for
that.
They
really are. So a way to think about exosomes is that they are 50 to 100 times more healing, more potent, more regenerative than the same amount of stem cells. So they're like stem cells on steroids. They are stem cell concentrate. It's all the good of stem cells and none of the potential adverse effects, none of the potential negative. It's just all the positive. It sounds like it's too good to be true, but there's 40,000 peer-reviewed published studies saying No, this is actually the goodness of stem cells in a bottle, and
Yeah.
none
And
of it
then
negative.
wouldn't you say added value too? Because stem cells, being that their cells won't break through the blood brain barrier,
That's exactly
whereas
right.
the exosomes can.
Yeah, there are patients, immune compromised patients, genetically compromised patients, who, if they did stem cell therapy, maybe stem cell therapy would historically have been their best hope for regeneration. But if they did that, their body couldn't take in allogenic, meaning donated stem cells.
Mm-hmm.
Even if you take stem cells from yourself, right? Basically, when you give your own stem cell and they'll process that and put it back into you, even that process of processing your own cells makes it so that when it goes back into you, there's an inflammatory response.
Mm-hmm.
And so, people think, oh, that might be, it's called autologous. If you give your own
Mm-hmm.
autologous cells, people think, well, that's safer. Well, it may be safer, but it's still inflammatory because
And
you're
the
putting stuff.
inflammatory response is part of what you're looking for, like PRP injections. I mean, you are creating an inflammatory cascade that is
Yeah.
necessary to create, yeah, part of the therapeutic action, and hopefully it all goes right.
And you're exactly right. And I can tell you, as somebody who was involved in marketing and getting stem cell products out, that was something that essentially we had to deal with. And so that became kind of how we positioned it. Well, you're looking for this inflammatory response. Okay, but the patient is already totally inflamed.
Mm-hmm.
That joint is already totally inflamed,
Mm-hmm.
and you're adding more inflammation, right? It's like, well, many of these patients, we don't need more inflammation. We need our
Mm-hmm.
inflammation taken away so that our uh, internal healing processes can finally catch up and go to work healing the things that need to be healed. And so with exosomes, you're just getting the good stuff and it's cutting inflammation. We have different modalities that we use to deliver the exosomes, but when they get into your body, whichever modality, Sharon, that you use with your patients, they seek out what science shows is they seek out any deficit from perfect and start repairing that deficit.
And
Whether
how is that mechanism different than stem cells, for instance?
Yeah, what a stem cell is doing, if it takes hold in your body and continues to propagate within your body, it's then kicking out exosomes.
Mm-hmm.
So it's only working in as much as it can spit out exosomes. We essentially take away the middleman and just take the most potent
Mm-hmm.
ever cells that your body produces, which are the mesenchymal stem cells from 0-day old placental and umbilical material, the most potent, most healing, most regenerative cells that the body ever produces. We harvest those cells, elicit the exosomes from those cells on day 0, process, package, and deliver them. And they're delivered via, depending on your condition, systemically via IV, sublingually in a sublingual spray, intranasally if there's brain-based degeneration or
Mm-hmm.
inflammation, or a brain-based condition. It's
Mm-hmm.
incredible for those things. It's remyelinating. It regrows the myelin sheath. Some of the myelin sheath degenerative conditions, right, like
Yeah.
MS and these sorts of things, it regrows neural axons. So it's neural regenerative, tissue regenerative, vascular regenerative. It's
Yeah.
angiogenic, which means it grows blood vessels. And so
So
just
this
an,
is, and this is like right where I want to go. Thank you for segueing right into it. Like the conditions and diseases where we're
sure.
using exosomes,
Yes.
because we're not injecting them. I mean, you can, right? But let's talk about an IV infusion. Like we're doing these IV pushes of exosomes,
Yes.
and we're doing it for many things. Like you could do anything systemic. And one of the questions I get, and I think this is hard for people to wrap their head around, because with stem cells, it's like, well, but I have this shoulder issue and I have spinal stenosis and I also have a bad kidney and this and that. And it's like, well, you need to do this and this and this and this and this if you're doing
Yes.
stem cell or you're doing any other medical treatment. And this is what really got me. It was like, okay, exosomes, we're going to put this in your veins.
Yes,
And it's going everywhere, right?
that's right.
So can you talk about that for a sec?
Sure. Yeah, you mentioned previously the idea of being small enough to cross what is called the blood-brain barrier. And I think what people need to know is that just means they're microscopically small. And so if you start them in one area of your body, they're going to perfuse throughout your entire body. They're not going to be held necessarily in one particular area. They can be helpful, for instance, for a knee or an elbow or a shoulder or a hip. They're incredible. And it shows, the studies show in our anecdotal experience with our close to 8,000 patients in the last year and a half or so, show that they're incredibly healing when you do a intra-articular injection or intratendinous or intramuscular injection. They're incredibly healing. What we see is someone will have right knee pain, osteoarthritic, rheumatoid arthritic, um, degenerative condition, bone on bone knee, and they'll get an injection in their right knee and their left knee pain will go away. The joints on their fingers that are swollen from rheumatoid arthritis, where they can't close their hand into a fist, their joints the swelling will go down. Not only that, we know, so the answer to your question is any degenerative or inflammatory condition or condition in which there are degenerative or inflammatory symptomology, those things are stopped and reversed by stem cell exosomes. The degeneration is regenerated. Cartilage, tissue, tendon, ligament, heart tissue, eye tissue, nerve tissue. There's studies of severed spinal cord growing back together again when exosomes are applied to spinal cord,
It's
growing back together
amazing.
again and translating signal.
How many exosomes? So let's talk about things like
Mm-hmm.
that. Like my ACL that's been gone for 15 years,
Mm-hmm.
that's going to be different than a severed spinal cord, right?
Mm-hmm.
Like we're going to need a different amount. And I'm assuming the age and the
Mm-hmm.
age of the patient, the how chronic the condition
That's right.
is. Can you tell us a little bit about some of the limiting factors that we need to
Sure.
consider?
Sure. So the highest powered, most statistically significant human studies, prospective, randomized, multi-center, double-blinded, right, placebo, multi-year follow-up human studies that have been done that have shown the greatest systemic effect against the top 60 degenerative and inflammatory diseases that plague Americans today, right? Those studies have been done. Hundreds and hundreds of patients. What those have shown is that there is a magic number in human adults of around 600 billion or more. We talk about exosome concentrations in terms of billions, right? That's how small they are. You can get hundreds of billions of exosomes in one application, in one IV. Specifically, we do 100 billion placental derived exosome IV. That is times 6 is what is being done in these human studies. And it's showing remarkable, statistically significant healing and prophylactic effects against the top 60 diseases, if you go down the line, top to bottom, that plague American adults. So there's that, right, as a kind of a basis. We know now, we also know that the higher the concentration, the more exosomes you take, the more healing they are. And so, there's studies that were done with 500,000, 1 billion, and 2 billion. And what they found was they essentially doubled the healing effectiveness each time they doubled the dose.
Hmm.
And so that was in favor of high concentration doses of exosomes. Of course, that was doing only 2 billion. You can give your patients a 100 billion IV. What we know, this was done in a cohort of type 2 diabetics, that one IV and 6 days of sublingual from home, one IV, 6 days of sublingual, lowers total body inflammation 500 to 1,000%. Your total body
It's
inflammation,
amazing.
it's amazing. And so those are big numbers, but
Yeah.
what we saw prior to having those objective numbers, what we saw was people would do one IV, they do start doing their sublinguals, and they were doing it for hip pain or knee pain or neck pain or low back pain, and that would go away. But the eczema behind their ear would go away, the psoriasis on their elbow would go away, uh, their gums would grow back.
Nice.
Their gums were receding in inflamed recession.
And when you look at dental health, being holistic minded here,
Hmm.
and this is something that biological dentists and
Hmm.
functional medicine people look at all the time, is what's in your gut is in your mouth,
Yes.
and what's in your mouth is in your
Hmm.
gut. And when you have receding gums, we know they say leaky mouth, leaky gut.
Yes.
And so when your gums are growing back that fast, you can be sure there's gut healing going on concurrently with that.
Hmm.
And that's really a big deal, because 70% of your immune system is in your guts.
Hmm.
And so you're really restoring a lot of immune function too.
Oh my gosh. And vision restoration and hearing restoration. Your hair regrows. Skin, blemishes going away. All the things that when you think about your body being in a state of constant inflammation.
Mm-hmm.
Wall Street Journal had an article maybe a month or so ago talking about the idea of inflammaging.
Oh
this
yeah.
this conflated word, inflammaging, and it was how science is finding not that aging leads to inflammation or includes inflammation, but that rather inflammation is actually the aging process,
Mm-hmm.
that inflammation is causing aging. And so if you can remove the inflammation, the idea being you can massively slow down or even reverse aging. And so that's, anything that, of course, and probably your listeners do as well, anything that ends in itis, right? Itis, colitis, and
Inflammation.
bronchitis, right? That's an inflammatory condition. And so all of these things, these gut related itises
Mm-hmm.
or arthritis, bone and musculoskeletal related inflammation, things like gout, which is just a crystallized form of
Mm-hmm.
arthritis, super painful. It dissolves gout. It takes away the inflammation and regenerates whatever has been degenerated by that inflammation.
Yeah. So
So,
sorry, not to interrupt. A couple of things. So I think like gout's a really good one, because with that gouty arthritis, buildup of uric acid, it's definitely, hard on your joints, hard on your kidneys. And I think that it's important to note, people are going to go to the trouble of having exosome therapy done, or these treatments. Like, you still have to do the work, right? Like, you cannot go out and drink beer and eat a high purine diet and do these crazy things that are going to continue to build up uric acid in your system. Because it does tend to run in families. And so if you are somebody who is genetically prone to certain diseases or disorders, such as gout, I think it still behooves you to do the things, to pay attention to diet and lifestyle, so that you're not just resetting the clock, so to speak. Because I think back to your idea of, inflammaging, that's a thing. Why would you just turn back the clock and then junk it up again?
mm-hmm.
Why would we not be limitless, if you will?
Mm-hmm.
And I think that that's such an amazing concept. I've always said, whatever days I have, I just want them to be good days.
That's right.
I don't want to just eke it along and just be average and just be okay. I want excellence the whole way through.
Mm-hmm.
And I want it for as long as I can, because I want to enjoy life. I love using my mind. And I will say that exosomes, my first infusion, that was crazy. To feel whatever that was crawling around in my brain, making it so much more. That was neat. One other thing I want to ask you just about these studies, watching these exponential decreases in inflammation. What criteria are they using? Is it like C-reactive protein, SED rates?
Stud rate. Yeah,
Okay,
so
SED rate.
that was ESR, which is a very
Hmm.
standardized blood panel. That's something that isn't necessarily defining any specific disease state. It's just,
Right.
hey, overall, here's your total body inflammation. The normative range is 1 to 20. It's a score of 1 to 20. So if you have a 20 ESR, you're at the high end of your SED rate score. We would see these are typically type 2 diabetics, 20 and 30 years of type 2 diabetes on 2,000, 3,000 milligrams of metformin, often not making the best lifestyle choices, right? I can think of our first one that we did, a gentleman drinking 1 2 liter of Coca-Cola Classic every day, right? And wanting help with his diabetes, blood sugar of 395. This guy, within 2 months of which was 2 IVs and daily sublingual, his blood sugar was 95. He was off of metformin.
Was he off Coca-Cola Classic?
He was not. He
Oh,
made, and so when I heard you saying these, hey, these are the things that you can optimize, right? He optimized nothing, you know, he optimized nothing.
I
And
mean, good
so,
for him, but still.
yes, could he have gotten better results potentially if he didn't drink a 2 liter of Coke every day? Probably.
Yeah.
Uh,
Wow,
but
that's amazing.
but it's so powerful. And
Yeah, that's
the beauty
amazing.
is that's what the studies say will happen.
Yeah.
There's a study titled Placental Derived IV Exosomes Manage Type 2 and Type 1 Diabetes Symptoms Better Than Metformin. That's the title of the study. And what I love is they are 100% natural. You can't get more natural
Yeah.
from nature, God's design, than
Yeah.
stem cell exosomes, right? These growth factors from the most powerful cells from placental and umbilical material.
Yeah.
It's as nature and God intended. And so that's a really fun thing. And I do want to talk about the timeline and kind of expectations. That was originally your question,
Hit-
and I went on a diatribe. But let me just say this: a lot of times people have a condition that they're aware of. Maybe that's the condition that they're focused on, but they also have other conditions, right?
Mhm.
But the condition they're focused on, they say, okay, well, I've found an intervention, exosomes, that could be helpful. And in their mind, they think condition times intervention equals outcome, right?
Yes.
I have this condition, rheumatoid arthritis. Exosomes is the intervention. I'll do that one time and my rheumatoid arthritis will go away. Well, they've had arthritis for 25 years.
Hmm.
So you have to think about not just the condition, but the duration of the condition and the severity of the condition.
Correct.
Then that has to be times, yes, exosomes is the right intervention for any degenerative or inflammatory condition.
Hmm.
But what concentration of exosomes, right? 1 milligram is not as powerful as 600 milligrams, you know? And so you can have the right intervention, but not take enough. So we know from human studies, 600 billion or more is a good starting point. We know that has a profound healing and prophylactic effect against 60 diseases.
Hmm.
Will that work with your 20 years of arthritis? Well, it'll be valuable, like, but it's really, so it's condition times intervention, which is in terms of the concentration, how long you take it. And then that's the third thing is time, condition, intervention, and time. You put all those together, that's going to equal your outcome. What we know is you're never going to harm yourself. There's no harm. You can't do anything bad. There's no reaction. Exosomes can't physically carry genetic material. They don't carry genetic material. There's no chance of that. There's no chance of an inflammatory response.
And
Just
this is this is one of the most beautiful things about exosomes is when you look at all of the biologic drugs, all of the and I'm not passing judgment on people who are on biologic drugs, but
Mm-hmm.
in
Sure.
the interest of first do no harm,
Mm-hmm.
that is the most exciting thing to me about
Mm-hmm.
exosomes is that we're not creating any harmful
Mm-hmm.
pathologies. There is no risk here. And
Mm-hmm.
that's one of the best things to be done.
Yes.
And I love that, like, I'm just going to take a little sidestep here. One of the first ones I gave was to, and I can tell she gave me permission. So a friend of mine, she's got malaria and she gets
Mm-hmm.
like 3 or 4 migraine days a week, like
Mm-hmm.
passed out,
Horrible.
in
Yeah.
the dark, full 10 out of 10. She's down.
Gosh.
And she did it. And, for me, I told you, like, I was like, I don't know what this is, but this is amazing. It was, you said stem cells on steroids and it was my brain on steroids. I was getting stuff
Yes.
done. And she was not that way. She said, I feel stuff crawling around in my brain, but I don't know what it is. And she
Uh-huh.
was driving home and she said, I pulled over. I thought I was going to have a migraine on the way home. She was about an hour out. And she said, I have not had a migraine. She said, I don't
Wow.
feel great, but I have not had a migraine. She said, I feel something in there. And I was like, you
Yes.
just got to keep going. But her expectations are in check because she's had this for a long, long time.
Yes.
And so, yeah, appropriate therapy. And she's excited about not having any harm come to her
Mm-hmm.
and having the patience to go, all right, I'm still doing all the things that I know are good for me. And I'm
Mm-hmm.
building up these exosomes in my system and I'm going to give it time.
Mm-hmm.
And I think that's important, is to keep it
Yes.
in check. And naturopathy, which is my heart and soul, we tell people, how long have you been sick?
Yeah.
Oh, 50 years. Well, give it 50 months.
That's right.
Not till you start feeling better, but 1 month for every year of sickness for healing. Now, exosomes, I think, are going to break that rule, right? Because obviously this is like a whole new ball game we're playing here. But this is just, it's astounding, I think, what it's going to
Mm-hmm.
do for people. I would like for you to please answer the question, what is the difference between placental and umbilical?
Mm-hmm.
And why are the exosomes safe? And why
Mm-hmm.
can we trust them? How can we trust them?
Sure. Well, so there's a donor selection process. If someone wants to be a donor of their umbilical and placental material, that is a very rigorous process. That mother and the material itself are tested for more than 350 diseases. It's so, the inclusion criteria is so strict that if a mother wanting to donate after a healthy, full term delivered pregnancy wants to donate her placental material, if she has one tattoo, she's excluded. You can't have a tattoo and donate your material because of the potential for needle stick,
Yeah. Hep
infection.
B,
That's
anything.
exactly
Yeah.
right. Yep. So can't have had the COVID vaccine. We test for COVID as well. So that all is included. It's a super rigorous criteria. What studies have shown, and the reason why we use the placental derived and umbilical derived only, those are only two that we source, is because we can objectively test for which proteins, growth factors, and regenerative signals are there and in what concentration. The cells that produce the most of those things, that create the most healing in the most amounts of tissue areas in the body, are the placental derived. And that makes sense. The placenta is the only area of the body where it's like nature's perfect 3D printer, right? Where for 9 months, those cells are processing everything that's needed to create an entire perfect human being from 2 cells, right? That's what those cells have been called on to do for the last 9 months. Fat cells aren't called on, aren't required to do that, right?
Right.
So they're not going to be as regenerative because they were never asked to be regenerative. They were never asked to generate anything. The placental cells were asked to generate everything perfectly. So we take those placental cells. One step down from those placental cells in terms of the most potency and the most healing is the umbilical derived cells. So that data has been collected that shows, what's in each of these things. The most healing are the placental derived. Next most healing are umbilical derived. Further down from that are stem cells from other parts of the body. There are fat derived versions that are out there. Those are significantly less healing and less potent. So the testing on the front end of the tissue itself is super important, and we do that, follow FDA, and it's called American Association of Tissue Bank, AATB standards, through a twice yearly physical audit that's done, and so we follow those things. Another component of safety with the exosomes is how small they are and their inability to pass on anything inflammatory or any whole genetic code. They can't pass on any of those things. Because of that, they become incredibly safe to be used, especially in immune compromised patients. Probably 10 to 15% of all the studies that are being done are studies where exosomes are being used in otherwise compromised patients who can't accommodate stem cell therapy, but need a therapy, need a regenerative and anti-inflammatory therapy. They can't do stem cells. And so that makes up a healthy component of who are being studied and published in the literature. So their size and the way they work, the fact that they're only proteins, growth factors, and regenerative signals, that's all they contain and nothing else, makes them super, super safe.
Right.
There's no contraindication if you're taking any other pharmacological intervention. If you have any condition, there is no contraindication. There's no adverse events. Hundreds and hundreds of thousands of uses over the last 4 and 5 years. Hundreds of thousands of them in the literature. No adverse events. So just all good and nothing negative.
So is that still the case even for people with active cancer?
Yeah, so we have a admonition we have a, kind of standardized consent form, right?
Sure.
To let people know, hey, this is what you're getting. That from a couple of years ago has hey, don't use this if you have active cancer. That being said, there has never been anything that says or showed that exosomes accelerated cancer,
Right.
that they brought on cancer where there was no cancer before. And there were many studies in the prior 2 years where exosomes were used as a therapy downstream of cancer treatment. So for post-chemo wasting, right? Exosomes were used. Well, there is an active cancer, but that patient had cancer before. When there's post-oncological prostatectomy, that leads to something like 97% of those men have post-prostatectomy ED.
Right.
Exosomes, with their tissue regenerating, neural regenerating, and capillary regenerating capabilities, heal the ED post-prostatectomy. So those studies were being done where, okay, it was in an oncological setting, a cancer setting, malignant cancer setting, and it was after that the exosomes were then used. In the last 12 months, there's probably 20 studies now where exosomes, stem cell exosomes, are being used as an index therapy fighting cancer.
Wow.
So glioblastoma, cervical cancer, breast cancer, glioblastoma is one of the most nefarious.
Deadly.
It
Yeah.
is so deadly. It's a horrible thing. And again, I come from a background in neurosurgery. Just how it totally goes through the entire brain, this kind of spider web. It's almost always inoperable. And so using it for exosomes, stem cell exosomes, for their cancer starving and new cancer cell blocking properties.
Wow.
And so, yeah, it really is.
That's
It
so
makes
exciting.
sense too, because in neurosurgery, the placental material, right? So just the inner lining of the placenta, we dehydrate that and lay that down as these little patches of placental
Mhm.
material, that is known to be cancer fighting. It's known to starve active cancer cells and block new cells from forming. When they do mastectomies,
Mhm.
they'll take out the tumor and line that entire area with placental material because of its cancer fighting properties. And so, and I know that, and that's been the case for 15 years,
Yeah.
20 years. That's how it's FDA cleared. It's cleared, the placental material is cleared as a dural repair. Dura is the cover for the brain and the spinal
Right.
cord. And so when you go in and do brain surgery, you do an oncological brain surgery, the only thing better than 2 pieces of placental material is 4 pieces of placental material. Like, it's like everyone knows this is good. It's going to heal. It's going to be antimicrobial. It's going to be analgesic, pain killing. It's going to be anti-inflammatory. It's going to be neural regenerative. We know that about the placental material. What we have is placental material concentrate. We have just the proteins, growth factors, and regenerative signals
Yeah.
from the stem cells of the placenta. So of course they're going to be, the studies are catching up to that. But to my mind, I look at this and say, oh yeah, of course it's going to be cancer fighting because the placental material is cancer fighting, which is
Yeah.
just, again, it's so awesome. The
Yeah.
placental material, like what a miracle, if anything, was going to just change the world in terms of healing and natural and get people off these pharmacological interventions that are total chemical,
Yeah.
give you vertigo, and like
Yeah.
it's
We've
horrible and
yeah, because
nefarious.
we've um confused practicing medicine with practicing pharmacology. And it's not it's not one and the same. And I think one of the really sad things to me, being a naturopath, I had to learn all the things. I had to learn to look at your eyes. I had to read tongues, read fingernails, look at your ears, and all of the things. And there are a lot of times once I went back and got my nurse practitioner's degree, where people were like, "Oh," and doing my clinicals, people were like, "Oh, nobody's ever touched me before." I'm like, "What?
Wow.
Nobody ever did an abdominal exam on you?" No
Yes.
wonder. Or, like one guy, I was like, something is wrong with this man's heart. And he's like, nobody's ever listened to my heart in this clinic before.
Wow.
And this is awful. And I
Just
see
hearing you
where,
describe those things, being able to read those markers, in my mind, I say, of course. Why would you not do that? Why would we not be teaching everyone to do that? How can that not be?
yes,
You know?
we cannot forget that medicine is part of medicine. It's 3D. It's touching, it's listening, it's seeing, it's experiencing everything. And then I think the exosome part of this is really bringing it home, because now we're taking a part of the human experience, which is birth, and
Hmm.
then we're applying it to life that is in process,
Hmm.
and we're rebirthing.
Yeah.
You're giving new life. and
Yes.
and it's a really cool feature. I'm so excited about this. I want to apply this. I want to hone in on a few conditions.
Hmm.
One that, Alzheimer's and Parkinson's, holy moly, that's so big. So what have you seen? What do you have to share with us specifically, like with what you've seen and what studies are showing with these two specific
Sure.
conditions?
Yeah. So Alzheimer's is a great example of that contrast, kind of the medical industrial complex, how they've chosen to go about with their 5 drugs that are approved for Alzheimer's treatment that do more than 100 billion combined yearly, right?
And they extend your life by 8 hours. No, that's serious. They
Wow.
extend your life by 8 hours.
Well, and so in the last 12 months, there's been 4 different studies that show that stem cell exosomes, when taken intranasally, we know that 90% of the exosomes that you take intranasally within an hour are housed in the midbrain and hippocampus, are
Wow.
taking away inflammation in the brain, are regenerating brain tissue. When they did these studies with Alzheimer's patients, the defining feature of Alzheimer's is a plaque called beta amyloid plaque that
Mhm.
grows on the surface of the brain. If you have beta amyloid plaque, BA plaque growing on your brain, you have Alzheimer's. Just like plaque on your teeth, right, and in your gums is a physical substance. It grows, and where it grows, it eats away whatever it's growing on. So this beta amyloid plaque is a physical substance, physical plaque, and it grows on the surface of the brain and it eats away the brain surface. Wherever the brain surface is eaten away, patients lose that function. And so almost like old school kind of hard memory in a computer, if you break off some of that memory, well, whatever was in that memory is gone now, right? If you can still access the other memory, that's fine. It's perfectly fine. It's untouched. But wherever you broke away the memory in the brain, that's gone now. What these 4 studies showed was that with intranasal exosomes sought out beta amyloid plaque and dissolved it. It regrew the tissue that had been eaten away by the beta amyloid plaque. And the patients regained the function that they had lost from their previously lost brain tissue. I'll give you, 10 guesses, 3 guesses. How many of those 5 drugs that are cleared by the FDA that do 100 billion or more combined revenue, how many of those do you think do anything related to beta amyloid plaque, regenerating brain tissue, or regaining function?
0.
0. None of them do.
Yeah.
And all of them come with massive side effects. They're all, how do we treat the downstream effects of this beta amyloid plaque doing its thing? Here you have something that is totally natural, totally non-toxic, totally healing, that seeks out the beta amyloid plaque, dissolves it, and regrows the brain tissue.
Yeah.
So I'm getting goosebumps because it's incredible. It's incredible. And it's from 4 different institutions. This is just what this stuff does. And so same thing, any brain degenerative condition, intranasal exosomes have an incredible result on that. Or skull-based, right? Oral maxillofacial. That can also be treated with sublingual. Any systemic degenerative or inflammatory condition can be treated with either IV or sublingual exosomes. And so really just we're at the front end of it, but the safety profile is extraordinary. How effective it is extraordinary. And actually the cost effectiveness is also really extraordinary by comparison, like all things considered,
Yeah. I have so many more questions I want to ask you, but we got to, CTE, traumatic brain, there's so many things I want to go into. We'll have to do this again, but we got to move on.
Yes.
I want to go into metabolism, because you talked about type 2 diabetes, insulin resistance, and I know a large part of my practice is perimenopausal, menopausal women. Inflammation comes into play. I think, environmental toxins that are present in our food, in our things we put in and on our body come into play here. And so how do you see exosomes indirectly or directly influencing weight and metabolism?
Sure. When you think about all the different hormones and insulin and blood sugar processing, right, all the things that are regulated by our organs, kidney, liver, pancreas, right, these sorts of things. When those are dysregulated, now our levels also become dysregulated. What exosomes do when taken systemically is re-regulate and heal, regenerate those degenerated organs. For instance, my 93-year-old father last year started taking exosomes once a month IV, daily sublingual and intranasal. 7 years before that, he had had acute kidney failure. And for the prior 7 years, had one kidney at 0% function, his other kidney at 20% function. He went every 3 months to his nephrologist since that happened, right, to make sure that his one functioning kidney didn't drop below 20%. Last April of 2024, he started doing exosomes, monthly IV, daily sublingual, intranasal. By June of last year, his one functioning kidney that was at 20% for the prior 7 years was at 90% function as a 93-year-old.
Wow. That's amazing.
This last month, right? So that's been a full year of him doing that. This last month, he's 94. So he went from 93 to 94. This last month, his previous zero functioning kidney that hadn't functioned for 8 years is now at 40% function, and his other kidney is at 90% function.
That's
And
awesome.
it's awesome. It
Yeah.
is awesome. And so you imagine that. And I'll tell you, his life, as you can imagine, he used to walk very slowly a couple times a week. He is rocketing around his neighborhood 7 days a week because his body is now functioning with one fully functioning kidney and a 40% functioning kidney
That's
at
great.
94. That's the opposite of the normal aging process.
Yeah.
And
That just flies in the face of everything we're told
that's
about
right.
getting older.
That's right.
Yeah.
And it is backed up. What has happened to his kidneys is demonstrated in the peer-reviewed published literature
I love
as
it.
well. That's what I love as someone with a science background. You know, it's one thing if something works, it's like, wow, we don't really know how it works. It just works. And I mean, that is a level of validation. That is a level of verification. But when everything we're seeing is exactly what the published studies say is going to happen, and then we see it happen, it's like, this is it. You
Yeah.
know, this stuff is it.
Yeah. So let's talk about orthopedics real quick. Systemic IV pushes versus joint injections, so
Mhm.
bone on bone. Is there a preference to getting, if you've got somebody with bilateral
Mhm.
hip degeneration, osteoarthritis or bone spurs or
Mhm.
whatever, what's the consensus there? Is there?
Sure. So there's incredible studies. We initially, a couple years ago, were moving in that direction. That was our main focus, was musculoskeletal orthopedic focus.
Mm-hmm.
It works incredibly well with intra-articular injections of the
Mm-hmm.
ankle, metatarsal joint, knees, shoulders, hips, and elbows. But what we have moved towards now is you can often get relief. So what I say is, if you have one area that's totally disabling to you, if it's 8 out of 10 all the time, if you can't sleep because your knee is bone on bone, if you're going to, go get surgery, okay, treat that acute pathology, of the
Mm-hmm.
knee
Mm-hmm.
with a intrajoint injection. Do that. And because they're so small, because of that ability to cross the blood-brain barrier, you will get a systemic effect as well. If
Mm-hmm.
it's anything less than totally debilitating, it's like, well, I've had this, painful knee, both my knees kind of hurt, my hips hurt. Sometimes it's a little worse, but in general, it's not totally debilitating. Then doing a systemic IV and sublingual regimen, because what'll happen? Your eyesight will get better. Your pericarditis will go away. Your colitis will go away. Your inflamed
Yeah.
skin will go away. You will have a 500 to 1000% reduction in your total body inflammation. The health benefits, the 93 to 94-year-old aging progression, your kidneys will regenerate.
Just
You know, it's
unbelievable.
it's unbelievable. It's like there was a movie, I don't even remember if I saw the movie, but I know the premise, Brad Pitt movie called The Curious Case of Benjamin Button,
Yeah.
where he essentially starts he's born
Yeah.
as an old man and
Goes
ends up,
backwards.
goes backwards. I feel legitimately that if you could do a long time, just consistent IV drip of stem cell exosomes, that would functionally be happening. You
Mm-hmm.
would be reversing your age. And so, I have a before and after. I do every other month. I do an IV, and I've done about 18 of them now. And I took a picture of my face the day I did my first IV, and I keep updating that picture. I've done no other facial anything, right? Typical guy facial regimen, right? Body
Mm-hmm.
wash, Axe 5-in-1 body wash,
Oh God.
uh, and nothing else, right?
God
No,
help us.
yeah, God help us. And it's undeniable. I look younger. My skin has less blemishes, less wrinkles, and it's 2 years later. That's not the normal aging process.
No.
And so it's again, an outward representation of inward regeneration. My body has better blood flows, newer skin, newer collagen, all these things. So
Yeah.
a fountain of youth.
Yeah. Well, and I haven't done the exosome facial, but I've done the PRP facials, and that alone, that is amazing. I know for myself, after 2 weeks, people are like, "What'd you do?" All right, well, there's the proof. Um, so okay, that's really good to know. That's really interesting. I love the systemic, but too, it's so simple. It's just it's such a straightforward approach to look. It's a simple, straightforward. Everything in your body is going to get helped, right? Because everybody has more than one thing wrong. We
That's
all
right.
have little aches and pains. I don't care who you are or what you're doing or not doing. So, okay, I want to know, what do you say to skeptics who view exosomes treatment as experimental or premature for chronic disease treatment? Or they're like, well, I need to wait and see, because I've had people do this and then 3 days in they're like, well, what did you think? I'm like, well, I think I'm like Bradley Cooper on Limitless, but that's me. I mean, I don't know.
Yeah. Yes. You know, the thing for me, and it might be because I come from this industry and so I'm so used to the peer-reviewed published studies as a form of proof.
Yeah.
The entire subject of brain surgery worldwide of all kinds, right? That entire subject produces about 3,000 papers, peer-reviewed published studies in the literature per year. Exosomes as a therapy is producing 3 times that. Just
Amazing.
exosomes as a therapy. There is nothing that has even come close. People are familiar, for instance, with BPC 157.
Yes.
And people
That's
love it, and
right.
it's a peptide, right?
Yeah.
BPC 157 has known to be therapeutic since the 60s. Since the 60s, there are 275 peer-reviewed published studies on BPC 157. There's 40,000 peer-reviewed published studies in the last 4 years on exosomes. Like
No
it's
comparison.
there is no comparison.
None.
And medical doctors in the medical industrial complex have no idea of that.
Mm-mm.
You know,
You're right.
they often have the audacity to say, "Well, is there a study?" And it's like,
Well, is
"Is
there
there
a
a study?
study?
Like, are you kidding me?" It's such a glut of
Yeah.
incredible, high-powered, diligently done, really proving studies on the efficacy of it. And so I try to educate people on that component, how it just all it is we now know how stem cells work. Do
Yeah.
they know about stem cells? Do they believe that stem cells are valuable and have the potential to be regenerative? Yeah, they do. Of course they do. Because everyone knows that. Well,
Yeah.
this is how stem cells work. They work through the mechanism of exosomes.
Exosomes. Yeah,
So we're
exactly.
just taking stem cell concentrate, stem cells on steroids, none of the negative, all the positive.
Right.
So we have made stem cells totally safe and concentrated their effectiveness, magnified their effectiveness. That's exosomes.
So let me ask you this. Where do you see exosome therapy in 5 to 10 years?
There are delivery mechanisms for targeting areas of the brain. There are, what we've found, we now have the highest available concentrations, hundreds and hundreds of billions. And we know that the higher the concentration, the more healing.
Right.
Well, there are ways to kind of nuclear reactor style get more exosomes and more concentration. It requires different tools, but there's more of them available. You can get even higher concentrations that would then be even more healing. So I think what we'll continue to see is the validation through human studies I think in the next few years, we will see exosomes grow to be covered by insurance as well, by private insurance. There's positives and negatives associated with that without
Sure.
getting too far into it. But we'll see that covered by insurance. The state of Florida actually passed in their last legislative session something saying as of June 1st, they are, as a state, explicitly backing, hey, we want doctors to use these sorts of therapies.
Nice.
Please explore these therapies. They're the first state in the union to do that. That goes live June 1st. I think other states, we're working on that with Texas legislature and some of our friends there. I think Texas will follow suit. I think others, North Carolina and some others, will follow suit.
Mm-hmm.
And so I'll tell you, this year, even versus last year, and certainly versus the year before that, there is much more acceptance. You know, when there's 10,000 new studies every year, and then another 10,000, and then another 10,000, eventually it becomes kind of an undeniable force.
Yeah.
And so we're still at the front end of it, but I think that will continue. We'll see that continue. We'll see it continue to be used as a healing therapy for degenerative and inflammatory conditions and all the conditions that plague Americans will see healing through exosomes.
Yeah. And I know we didn't really get into autism, but I'm so excited just to see the impact that it has on spectrum disorders and
Yes.
yeah, just really helping to recover those brains because, you know, God bless those kids with autism and adults with autism because
Yes.
they're in there, you know, and I think
Oh
we
my
have
gosh.
all these kids and these adults that are trapped in those bodies and they're in there, you know, and I think
Yeah.
exosomes are going to allow them to be freed.
We've seen some of the most incredible results in the pediatric autistic community. I think a portion of that is because the parents are just so dialed in, right?
Yeah.
And every little thing they see, they note and share. So then we get those back. But you talk about kids from intranasal or sublingual exosome administration going from nonverbal to verbal, from
Mm-hmm.
haven't made eye contact for 5 years to making eye contact,
It's
from
amazing.
no locomotion to getting text from the parents saying, well, they won't stop pacing, you
Yeah.
know?
Yeah.
And it's like, hey, do we need to be worried? They won't stop pacing.
Yeah.
But from they weren't locomoting before. And so what an incredible, it is working. And that's exactly what the studies say as well.
Yeah.
So, and it's safe. You're not giving your kids a drug that has some potential risk profile that could
Mm-hmm.
hurt them in this other neurological way,
Right.
right? It's only going to help them and heal their body.
Right. And you're not creating these the proverbial healing crisis or these Herxheimer effects where it's going to
Mm-hmm.
get worse before it gets better,
Mm-hmm.
like you find with a lot of things. Okay, last question, and I promise I'm going to let you go. This is so much fun, and I could keep talking to you for hours and hours. This is just fascinating. But if you could bust one myth about exosomes, what would it be?
Yeah, I think the myth that either it's not safe or that they can't be done. You know, there's a like they can't be done in America. I think that's something specifically when you start talking to people, I was like, oh yeah, no, for sure. Go to Panama for that, or you got to go to Dubai. It's like, no,
No.
you you know, in the Dallas suburbs,
Yeah.
close to your hometown, you can get this today,
Dallas
and
proper, K6
that's
Wellness
right.
Center.
Heck yeah, Dallas proper. Uh, in the Metroplex area,
Mm-hmm.
you can get this today and you can get it in your hometown in all
Yeah.
likelihood. So, that's the biggest thing. There was on our Instagram, I shared Kevin O'Leary, who is like
Mm-hmm.
Mr. Wonderful from Shark Tank,
Mm-hmm.
talking about getting exosome IVs in Dubai, right? And okay, well, that's great. You don't have to go to Dubai.
Yeah.
Like it is available today. It is being done thousands of times. and people are being helped and healed right here.
Yes.
So I think that's one big myth that I'd love to dispel.
Yes. Well, that's awesome. Well, I so appreciate you spending this time with us. We love having these conversations, and thank you for helping us get the word out. I think that this is such amazing information, and I hope that today's episode gives our listeners new insight into how exosome therapy is really changing the game in regenerative medicine, helping the body to heal, repair, and thrive from the inside out. So, listeners, don't forget to like and subscribe if you're watching on YouTube. Follow us on Rumble, Facebook, LinkedIn, and Instagram for more wellness content. And if you're ready to explore advanced therapies and personalized care, visit us at k6wellness.com to learn more or schedule a free discovery call. Until next time, take care, be well, and as always, your health is worth fighting for.